Among all the treatment options for end-stage renal disease, as we all know, kidney transplantation has found its place as the optimal treatment for most patients because of the improvement in quality of life, patient survival, and also healthcare savings. The problem that all transplant units in the world have been plagued with since the beginning of kidney transplantation is that there's not enough kidney grafts. Even more so these days because of the increasing rates of risk factors for end-stage renal disease and also the increasing rates of CKD in all age groups above 45. Another issue is that the deceased and living donor kidney numbers are reaching a plateau in most places worldwide. For example, in the UK, there haven't been any significant improvements in the donation utilization rate the last decade. It makes you wonder whether this is an epidemic actually, because 1 in 3 adults in the US are at risk of CKD, which is astonishing really, and 37 million adults have CKD of all stages, of course. Some of them will progress to CKD5, and some of them will need a kidney transplant. And currently, there is around 100,000 people on the wait list for a kidney transplant. Comparisons at international levels are difficult, I would say, very hard to make, because we want to learn from the best out there, but there's so many cultural differences and also so many differences in systems from pre-transplant, transplant workup, wait list, registration, presence or absence of DCD programs, living donor policies, legislation, and so on. So I like to stick with the simple metrics that give you an overview of what's happening in the rest of the world. Kidney transplant rates is a useful metric to compare countries and see where we need to draw our attention to learn from the best of the programs. However, it's not as simple as it seems. Even countries that are socially or financially or economically similar, they have huge differences, as is a typical example between Greece and Spain. But if we look at good programs, good organizations, and I think UK is, could be easily considered a world leader in transplantation of all organs. If you look what has happened in the UK the last decade is really astonishing. They managed to narrow the gap between transplant list and actual transplants quite significantly, to the point that now they have reached a plateau. The problem with this plateau is that it still maintains and sustains a deficit of 2,500 grafts per year, which is quite difficult to bridge. And if you look even deeper into the data, then you'll realize that this is only part of the picture, because it's only the people who are active on the list and not the people who are, have been suspended from the list and at some point will be reactivated, which will create an additional deficit of another 3,000 grafts. In the meantime, survival is not getting much, and especially in the age groups above 55, it's quite pessimistic, I would say. In the US, there's a similar picture, although there's been a steady increase over the number of deceased donor kidney transplants. Unfortunately, there's also been an increase in the number of candidates on the waiting list because of the progression of CKD risk factors, and created this fairly static picture on the kidney waiting list numbers. In absolute numbers, the situation is even worse than it seems. This is an excellent editorial from Jason in 2018, titled "The Terrible Toll of the Kidney Shortage." And if the actual figures, they're really worrying. There is 126,000 new diagnoses with ES annually in the US, 16% of which will end up having a transplant. But the problem is that around 100,000 people will continue to receive dialysis until they die prematurely. And obviously, if you do a simulation and look into the future, what the future holds for these patients, then you come to the conclusion that in a very short period of time, actually 8 to 10 years, there will be another 500,000 premature deaths. These are deaths that could have been avoided if there were more grafts available for these people to be transplanted. There are strategies, of course, and some of them have been very successful in other places of the world. DCD programs and promotion of living donation actually can increase effectively the number of transplants. Living donation goes hand in hand with the kidney sharing schemes and the incompatible programs, which are useful resource of grafts. At the same time, I think the focus now is shifting worldwide, especially in the US and the UK and other parts of this world, in terms of maximum organ utilization. And we have one of the national lead kidney organ utilization here with us, which is the next speaker, Nick Kinston. These strategies aim both the allocation and the utilization of marginal kidneys with double adult kidney transplants, donors with a history of cancer, viral disease, AKIs, and so on. New technologies are extremely important in my view. Machine perfusion has proved the concept of a viability assessment, and I'm hoping to see studies with pharmacological manipulation of grafts to resuscitate marginal grafts and make them usable. Xenotransplant artificial organs are the topic for our next speaker, and at the same time, I'm hoping to see more effective legislation being implemented worldwide to promote donation and transplantation. In the meantime, though, don't forget that we need to have a lifetime RRT plan for our patients, in my view, to support and maintain best possible quality of life through good vascular access, preservation, appropriate intervention, and the development of new materials to allow us to provide this quality of life. Thank you.